I'm trained in emergency medicine. I'm an ER doctor. I trained at Long Island Jewish Hospital, which is where I met my partners. And we were fortunate enough to be able to come together and build a really wonderful company called CityMD, which is an urgent care. It's pretty dense and densely based in New York. And what we really were able to disrupt and change, especially in this region, was the way people accessed healthcare. And CityMD really was that solution. I was there for almost 17 years, taking it through lots of different twists and turns. One of the big challenges that I noticed in the emergency room, as well as in the urgent care, was there were a lot of people that needed help, not just transactional medicine help, but there were people struggling with mental health problems. And it wasn't easy to get people plugged in. Either it wasn't accessible, or more importantly, it wasn't affordable. And when I had this opportunity to work at Thriveworks, I really jumped at it. Thriveworks is a national company. We provide care in all 50 states, call it outpatient mental health, from talk therapy, social workers, psychologists, including medical management, psychiatrists, nurse practitioners who prescribe medications. Really trying to give ourselves as much reach as we possibly can to solve these problems. It's not just access, it's not just anything, it's the right person, the right relationship, and the right approach, something we really focus on, is making sure that we're not just marrying two people and connecting them, but the right person, patient, with the right clinician that's able to really solve their problems. My connection to Touro is actually, I really got introduced through Joe Tomasino. We opened up a fellowship to train PA grads and teach the appropriate way to go about urgent care. I'm graduated into employment at CityMD, amongst many other things that Joe, always super creative and driving, got us to do, placing students in other parts of the organization. What Touro does, and certainly what I've been exposed to and how I feel, it's a mindset. It's about, let's identify a problem, let's figure out how to solve it, but let's not stop there. Let's make this accessible. Not one or two or three people or regions. Let's make it accessible to everywhere. You have to have courage, you have to have commitment, but following your instincts and again, going in there, leaning into these problems, there's so much similarities. Myself personally, the organizations I've been a part of, certainly at Thriveworks, to the way Touro approaches what they're trying to do.
He's got a lot of those special attributes, not just being a very smart businessman, not being an amazing doctor that can handle 300 plus patients in a 12-hour shift. He's doing this because this is a mission. He's one of these guys who is driven by the needs of others. Now, if you know Joe and if you know Dan, to put those two guys in a room together with their ideas and their visions, and I think both of them just matched. It was a match made in heaven.
He is a model of the idea of tikkun olam and care within the community, solving a problem for folks. And I think that those things align very nicely with the largest educational institution under Jewish auspices in the country, Touro University.
Touro has a unique but really effective mode of education, and that's something that I would selfishly like to infuse here at Thriveworks. Learning as a clinician doesn't stop when you get your degree. It probably begins when you get your degree, and being able to encapsulate that and use some teaching methodologies and structure, content, curriculum, syllabi, so important, and it demonstrates our commitment to our clinicians and to our craft to make sure that they're getting better. And a partnership with an institution that's going to allow us to further that is going to make both of us better.
We're so focused on trying to elevate people in the sense of, we're going to give you this outstanding education and you're going to take it and have a great career, but you're also going to take it and use that knowledge to really better the lives of other people in the community. And Dr. Frogel is a perfect match for us in that regard. His career has clearly been about, yes, how do you have success, but ultimately, how do you have success through benefiting other people? Here is this great clinician, this great business person, who just also happens to be an incredibly kind and generous person, has been unbelievably generous with us in his support of this memorial scholarship focused on behavioral health. And it's hard to imagine a more worthy honoree given the impact that he's had on medicine, on business, and most importantly, on people's lives.
I love what I do. I love the people that I work with, and to be able to have the opportunity to work in healthcare, to really see the fruits of your labor and able to help people, and now enabling people to help others, is really special and important to me. It makes getting out of bed every day really easy.